The CDC's decision regarding COVID vaccine guidelines has caused a lot of confusion among some patients and their doctors. On Friday, a panel of CDC advisors voted to abandon its previous recommendations for anyone 6 months and older. Instead, the committee voted to suggest that Americans get vaccinated based on, quote, individual-based decision-making. Joining us to talk about what this means for healthcare providers and those they serve is local infectious disease specialist Dr. Dee Banks. Thanks for being here, Dr. Banks.
Hi, Derek. Thank you for having me.
So what is happening right now in the medical community regarding vaccine recommendations? Why may it be confusing for healthcare providers right now?
Well, thanks for having me on, Derek. It's very confusing for a lot of people. Of course, those of us that are infectious disease specialists, I don't think it's too confusing because we're sticking with the science. Let me preface this by saying that the concept that they're talking about is something called shared decision making. And it's a concept that's used in medicine now that, gives the patient and the physician an opportunity to work together to try to come up with a decision about the patient's care. The problem here is that a lot of the onus is going to be put on primary care physicians and pediatricians who may not necessarily understand the scientific basis for not changing the guidelines that we had in the first place. So I'm concerned.
For sure. Could this also cause some confusion and issues with how the shots could be paid for?
Yes, you certainly don't like to talk about money, but the reality is the COVID vaccinations are expensive. And when insurance companies don't have guidelines that they can sink their teeth into, and patients sometimes are left holding the bag, and these vaccines are quite expensive.
And do you think less people will get vaccinated if insurance isn't covering these costs?
Well, I think, even for myself, when I go to the pharmacy and something's not covered by insurance, I have to take a step back. But I think that, the COVID vaccinations are important, but you also have to deal with the reality, like I said, they're quite expensive.
Do you think the situation might cause COVID numbers to spike again?
Well, that's another thing, Derek. I think and I want to be clear that the reason that we have the vaccines, and that was something that was brought out on one of the sessions last week, it was never designed to prevent COVID infections. What it was designed to do and what it did well was to prevent hospitalizations and deaths. And what we know now that happens every fall, we start to see an uptick in the number of COVID cases in the community. Certainly it's happening all over the United States and starting to happen a little bit in our community. It's going to get cold and people are going to start coming back inside. So yes, we're going to start to see an uptick.
Are you seeing any new variants out there? Are we reporting on new variants?
Well, we are reporting on new variants, and if you will, the cousin of the newer variant that was out is covered in the new vaccines. We have 2 brand new vaccines from Moderna and Pfizer. If you got an old vaccine, that's not going to be effective. These vaccines cover the JN1 variants, if you will. So these are the ones that you need to vaccinate get vaccinated, whether you go to your pharmacy or wherever you get your vaccinations from.
Excellent.
Our recommendations have not changed. I can't speak for every ID doctor. I don't know them all, but I'm in leadership in the Infectious Disease Society of America. Our guidelines have not changed.
Finally, Dr. Banks, what do you suggest for people who may be living with at-risk people like elderly, babies, or those with health issues who aren't sure if they qualify for the vaccine?
Well, again, I think a lot of physicians are watching the news. A lot of physicians are smart people. Again, take the suggestion of shared decision making. Go to your physician. I never encourage anybody to go past their doctors. And I'm hoping that they will encourage those guidelines that we've not deviated from and get vaccinated.
Excellent. Dr. Banks, as always, we appreciate it.
Thank you. Thank you so much.